Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us today.
Well, thank you very much for having me
Yes,
on the
sir.
program.
Yes, sir. I wanted to begin with yesterday's vaccination campaign at Queen's College. What was the response like?
I think we had an excellent response there. We saw a lot of students came out, and of course the teachers have been helping us with documenting the children's information. So they've been assisting with the registration process. So the staff of the ministry focused more on doing the vaccination. So I think the collaboration was a good one, and which allowed us to really being able to provide more vaccination for the people who turn up. Yesterday at that school alone, we did about 920 something vaccines. I think that's really good. So this has been one of the highest vaccination rates by school that we have completed so far. So what we are trying to do, we are building capacity in each of the regions. So we have started in Region 4, obviously, and we have been able to do that in Georgetown. We have done that on the East Coast, and we have done that on the East Bank. And so they would be able to continue doing that kind of work. And now we're moving to Region 3, where we'll be adding similar capacity. So in Region 3, as of today, we'll be at the West Demerara Secondary School, and we would also be at the Lenora Secondary School and at Greenwich Park Primary. So I do hope that persons in Region 3 would bring their children out to these facilities. As we've been saying, what you have to do is make sure that you walk with some form of identification where we'll be able to see the age of the child, because we're only vaccinating children between the ages of 12 and those who are under 18. So once you're within that age group, we'll be able to do your vaccination for you. And in addition to identifying your age, we'll like to get parental consent. So we want the parents to sign and to make sure that we have that parental consent. So I'm optimistic again that we'll have a good day today in Region 3. I think we're really doing well over the last couple of days. So yesterday we have had record numbers of vaccination. So yesterday we recorded 5,240 persons receiving their vaccination. So I would say that's a record high for us. And I do hope that this trend continues. So we had, of this 5,240 doses that we gave out yesterday, 951 were given to children, 1,694 was first dose vaccination, and 2,595 was second dose vaccination. So I think we had a very, very successful day yesterday in terms of vaccination. We are looking at approvals probably coming from the US FDA sometime by mid of this month, later this month, by the end of this month, which would probably grant emergency use authorization for children between the ages of 11 to 5. If that happens, then we'll be able to give the vaccine to children within this age category. But until we get that, or we see that approval happening in the US, we'll be confined more to the 12 to the on the 18. So what can parents do? They're simple things. You have to make sure that your children are properly masked up when they're at least in the public. You have to take those precautions like sanitizing, social distancing. These would help to reduce the chances of getting infected. And if people take these simple measures, I think it would help us greatly. We have been looking at patients who would have recovered from COVID but are now experiencing prolonged symptoms. And because of how many persons have recovered and we have been hearing different things, what we are now in the process of organizing is a multidisciplinary team to provide care for long COVID patients. So this is not just one specialty. It's not just like cardiac, or this is going to be a multidisciplinary team, because what we are seeing with COVID, it can affect any one of the organs in the body, or sometimes several organs of the body simultaneously, and therefore you need this multidisciplinary team to assist in the management of some of these patients. So we are in the process of setting up that unit to be based at the Georgetown Public Hospital, and we will then be able to replicate that to some of our other regional hospitals, depending on the patient load that we'll see. So we are working with the doctors at the hospital to set this up. So as of yesterday, first dose vaccines would have been 316,973. That's first dose adult. So that's about 61.8% of our adult population. And we've had 165,401 second persons receiving their second dose, so that's 32.2% of our adult population. We have 4 children as of yesterday. We have administered so far 4,362 doses of the Pfizer vaccine to children between the ages of 12 to 17. Well, generally, most people don't have access to gloves, so I think most people would be moving around, touching surfaces, and that's they do it unconsciously, and there is that possibility that you can touch a surface that has been contaminated with the virus. So the safest thing to do after you have touched surfaces, or at some frequent interval, to sanitize your hands so that you can prevent getting infected.
Well, that's it for today's COVID-19 update. We've just spoken with the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms.